Jaclyn, I am so excited that you're here with me today. Thanks for the gift of your time and welcome to the show.
Thank you. Excited to be here. Let's get into it.
Well, as a pediatric PA in doing this podcast, I have referenced the Feeding Matters tool a lot of times. And when your team reached out to me to have you as a guest on the show, I jumped at it because I'm so excited to share this resource with my clinicians. And I think it's so valuable for pediatricians and speech pathologists and dietitians to really, really, really understand the difference between picky eating and a pediatric feeding disorder. So that's where I wanted to start off with. Can you please explain the difference between those two?
Sure. So I think that is the most confusing piece is picky eating is something very typically developing that we all expect our kids to go through at any particular given time. But the unfortunate thing is that because we do expect that to be a phase, we end up misdiagnosing or misunderstanding when a child is trying to give us signs that there is something else going on and something a little bit deeper. So pediatric feeding disorder is when a child really isn't eating appropriate for their age. And it may be that there is dysfunction in any one of four domains: medical, feeding skill, psychosocial, and nutrition. And they all can impact one another, and one can be a primary driver at another time. So they really interact like a system. So I think one of the biggest questions that I like to ask families is, has there always been a history? Did we have trouble breastfeeding, and did we have trouble switching to solids? Like, what does that history look like? Because that gives us a little insight into what developmentally might be happening. One of the things that we're learning out of research is that feeding skills are being developed and being refined way longer than previously thought. And so oftentimes people think of a 3-year-old as fully developed in their feeding skills, but it's often much later.
Now, you mentioned four domains, and we'll get into those in a little bit, but does a child have to meet all four domains in order to qualify for a pediatric feeding disorder, or could it be just one of them?
It could just be one of them. So pediatric feeding disorder is classified for a diagnostic code as acute versus chronic. And it is, to qualify for the diagnosis, just needs to be happening more than 2 weeks. And the dysfunction needs to happen in any one of the different domains and be impacting age appropriate feeding. So they do work in tandem, but you only need one dysfunction to qualify.
It's so fascinating how the science is going towards this, and we're learning so much more about it. And I think clinicians are a little bit behind on where the science has been. I've heard so many of my colleagues just unfortunately, label a child as a picky eater, which, side note, I hate that terminology, and I'm sure you do too. And very often on my podcast, we use selective eater or curious eater as opposed to just negatively labeling them as a picky eater. So I would love for you to educate my listeners on what should a general pediatrician, whether you're an NPPA, MD, what should we be looking out for to know that it's not just developmentally appropriate picky eating?
Sure. So if a family kind of mentioned that they've always been a picky eater, no matter what age the child is at, because I think sometimes we see a family do everything in their power to try to get their child to continue to gain weight, but oftentimes has trouble going into, and articulating what those meal times look like. So we've heard from families that they are feeding through the night just to make sure their child is gaining weight. But if they go into the room, it's, they've gained weight, they're good. It's all fine. But I think asking that deeper question of, what do meal times look like at home? How are you feeling about feeding? In addition, in thinking about all of the different domains, if there's ever like choking, gagging, vomiting, kind of all of those signs definitely need to be addressed and looked at from all four domain perspective, and before even progressing with any type of therapy or anything.
And there's so much more going on at home than we can actually do in 10 minutes as a well check with the family. So it's so complex.
Yeah, I think that's like one of the biggest challenges is you're only getting a snippet of time. And there's so much more. I mean, it's not an area where a child breaks a leg and is going to physical therapy and they can take a break and go on a trip. It's every single meal, 5, 6 times a day.
Which leads me beautifully into my next question. And that's the stress that families are feeling with a child with maybe an undiagnosed PFD, as opposed to what's different about maybe, selective eater. Because I sympathize with these families and these parents who come in and they're just like, I cannot get my kid to eat anything. So I just would love for you to paint the picture of like, what is so stressful about this with families with a child with PFD?
I think it's a vicious cycle because I think it's a child isn't eating, they may not be gaining weight, The family may feel pressured to help them gain weight, and then that puts pressure on the mealtime. The family may be anxious and may bring their own experiences with feeding into the mealtime. And so it creates this scenario that doesn't really set the table for a good experience for anyone. And I think that just erodes the relationship, it erodes each individual's person's experience and the child's psychosocial development and their relationship with food. And where we see a child growing up in that scenario, especially with an undiagnosed PFD, it can turn into avoidant restrictive food intake disorder, or ARFID. And that's where the anxiety just is overwhelming, and that becomes the primary driver, even if feeding skills are intact and even if the medical piece is figured out. But I think for parents, they are overwhelmed with the stress and the constant need. I mean, I think even as a parent, you know how hard it is. I mean, one of the biggest jokes online is like, I don't know what to pick out for my family at dinner every time. But if you've got a child with PFD, it's exacerbated 10 times over.
That is so true. I mean, every mom listening is like, amen. Like, I hear you, because even if you don't have a selective eater or a child with a PFD, feeding them is tough, and we have to feed them. It's like something that comes back every day, 3, 4 times a day. You have to feed your children. And so it is so overwhelming and so stressful for families.
Oh, well, yeah. And I think the other piece to that is like, depending on how medically complex they are, or if they're working with you as a provider to try to figure out if there's something else, like oftentimes the family is becoming that medical home partner to you, of doing the calls to the specialist, waiting on those lists, trying to figure out what they do while they do wait on those lists. So there's all this like added up mental load as well that becomes a challenge.
That's why I'm so excited to get into this tool and to just share exactly what Feeding Matters is and how can a busy provider actually use this tool in clinic.
Sure. So the tool that we're specifically talking about is our infant and child feeding questionnaire, 6-question rat card. And what it does is it describes what PFD is, the disorder. It includes the ICD codes in there. And then it has 6 questions that ask about meal times. And it's been shown to have a high sensitivity and specificity for identifying PFD. I will say it doesn't distinguish between picky eating and PFD, but more typical feeding development and PFD is what the research has been done. I do think that there is a long way for research to go to differentiate like picky eating, but I agree with you. That term, it just breaks my heart so many times in so many of our families. So selective eating or any of the other like eating characterizations. And so the tool that we have allows you to really take this with the family that's in the room with you. And that also may help them open up to what meal times are about. And that's, I think, is happening sometimes, is a family might not either be empowered to share what's happening or have the words to share what's happening. And so not only is it a tool to help you say, do I need to spend a little bit more time talking about feeding, which is, I think, how it should be used, but it also can be that tool that can navigate conversation. So beyond the 6-question screening, we do have a full-fledged infant and child feeding questionnaire that is a smart tool on our website that adjusts for age based on, prematurity. And it allows for the parent to take it even deeper questionnaire, ends up being around 11 to 14 questions based on age. And so that's another tool. I will say that Feeding Matters as an organization, we are a nonprofit advocacy and education organization. And so we do have a multitude of tools that are available and that you can leverage. We were the birthplace of pediatric feeding disorder. So we do have a lot of experts that share their information with any general pediatrician or physician or provider. And we have a family guide. So if you are worried that a family is, going through this and you aren't sure where to send them, we have a provider directory, but we also have a family guide that helps the family walk through what might be happening. And then we also offer some support for families too through our parent-to-parent coaching program.
Such an invaluable resource. And I have actually used it multiple times in practice and in clinic, because I just find that you're right. Like sometimes the families don't have the words to say, or even me. I completely understand what it feels like as a clinician when you're just so overwhelmed with referrals and refills and the rash that they're coming in with, and their other kid is sick, and like it's a lot. And then let's talk about the child that is only eating 10 different foods now. It's a lot. And you can sometimes feel like, I have no idea what to say. So then you just ask, oh, is your kid eating okay? Yeah, I guess he's fine. And then we move on and we've completely missed so many underlying issues. And so that's why I really like how this has specific questions to ask and that can kind of guide you a little bit further. So can you go into those 6 questions on that first tool?
So the questions that are good to ask are, does your baby or child let you know when he is hungry? The red flag would be no. Does your baby or child eat enough? Like, do you think your baby or child eats enough? Red flag would be no. How many minutes does it usually take to feed your child? The options that are on the question are less than 5 minutes, between 5 and 30 minutes, and more than 30 minutes. And that is because this questionnaire is developed, the longer form one has different questionnaires per age group. This one is for 3 and younger. And the questions still show validity because it does count for, if a child is bottle feeding or breastfeeding and they're under 5 minutes, or even if they're at the table and they're under 5 minutes. And similarly, the red flag for under 5 minutes and red flags for over 30 minutes. It shouldn't be taking that long either. And then, do you have to do anything special to help your child eat? Definitely a red flag for yes. Distracted eating, any sort of configuration of how we're setting ourselves up at mealtime would be a red flag. Does your baby or child let you know when he or she is full? No, would be the red flag. And then, based on the questions above, do you have concerns about your child's feeding? And that's, I think, a key piece that is important to make sure you ask the family, because I think that'll open up the discussion a little bit.
Yeah, I love those. And I actually start with that last question because I find it's a really good open question to kind of gauge where the mom or dad is coming in with and what they're really concerned with. A lot of the times they say yes. And then actually, my next question is, "Well, what are you concerned about?" And then they often will feel like the child doesn't eat enough, which
Mm.
gives you a really good opportunity to then ask, like, okay, well, how many different foods are they eating? So it does guide you really, really well. So I just absolutely love those questions. I think they are so helpful. Now, within Feeding Matters Toolkit, is there a guideline of like how many different types of food would be considered a pediatric feeding disorder? Because I get this question a lot from colleagues of mine of like, well, the mom said they eat like 10 foods. Is there a standard or a guideline when it comes to how many foods a child eats? And like, yes, they have a feeding disorder just based on that alone?
Not just based on the number of foods. I think that there is a good opportunity to research that, because I think that is probably the easiest way to articulate from my family side and probably from your side as a healthcare professional of where we're at in meal times as a benchmark. It is not within the diagnostic criteria. There is work out there of people saying, the less than 10 or the 10 to 20 and then the over 20, but there's nothing that we say is behind that diagnostic criteria. I think it's really about, has it become stressful at meal times? And that's why the domains are important. And so there's another resource that we have where the back kind of asks like different questions based on the domains. And a lot of it is like, what are the behaviors like at meal times? Like what does that look like? And but not as much based on the number of foods. I do think that there is some space for the research to grow in that, because it's the easiest conversation topic, I think.
It is and it isn't, because when you dig a little bit deeper on numbers,
Yeah.
parents significantly underestimate how many different types of food a child eats. They'll say, like, oh, well, he only eats 5. And I ask a few more prying questions, like we really get into the specifics. And it turns out it's like, like more like 15 because, yeah, they only eat chips, but it might be chips and pretzels and crackers and cereal. So I can appreciate that you guys, maybe didn't include that or that's not part of the diagnostic criteria because it is pretty subjective.
Yeah.
And again, like you said, within those domains, it might indicate more of, a selective eater. And obviously there is still an issue if the child is literally only eating 3 brands of chips and fries and whatever, but might not be a PFD. So I really appreciate that piece that you guys have with those domains. So I do want to sit here for a little bit and talk about the 4 different domains because you mentioned it in the beginning.
Mhm.
Can you tell us those 4 and then kind of like what falls within each section?
Yep, for sure. Pediatric feeding disorder was developed by a multidisciplinary group of individuals. And they came together saying, we're kind of seeing these different things, but we're all looking at it from a particular single lens within our discipline, but these children are facing all of us and we all need to be talking together to be able to treat them. So by and large, the diagnosis is very different than we're used to in healthcare because it's designed to be this complex, multidisciplinary diagnosis. It was also mapped onto the ICF, the International Classification of Function, Disability, and Health, which is a worldwide characterization type of coding manual like the ICD, but it does involve all of the things like how is the environment at play? What is the activity? So it's all based on what is a child and family's function during meal times and their experience and relationship during meal times. And so that's why you have the different domains and the dysfunction being kind of that link to be able to qualify for the diagnosis. So what I like to talk about is there's the diagnosis of PFD that has the specific diagnostic criteria, but then there's the PFD framework that helps you just really think about things going on. And so that's like on the medical side, is there labored breathing or color changes, multiple formula changes in the history, never seems hungry, lots of vomiting, a history of lots of vomiting. Are there other things that we need to be thinking about from the medical lens? Similarly, on the nutrition side, unable to drink, not getting enough, not having a diet that's diverse enough. We're only eating, you know, chicken nuggets and that's all that we eat. Feeding skill and psychosocial is the most depth that's in the diagnostic criteria as well as in the framework itself. But what we do see is those overlap so much as a child is developing their feeding skills and their psychology related to food. And so on the feeding skill side for a baby, it's more about like, do they have the skills to be able to suck, swallow, breathe? And what is that experience like? Are they able to move their tongue? Are we able to fully sit at the table, bring food to our mouth, use it and swallow it and have an okay experience doing that and have enough diversity? Are we safe to eat? Is it age appropriate? Are we still on a nutritional drink as most of our calories and nutrition? So those are kind of the different considerations as we look at the PFD framework. And I think it's a critical time after a year old when we're kind of weaning off the bottle and all the formula. And that's a critical period, I think.
And I think you make a really good point that parents often forget that feeding is a skill. It's not just about getting the food into their mouth, and it's not just about the nutrition that they get from the food. It's a skill that they have to learn and perfect, and it's going to take years, but it is a skill. And like you said, it's that critical time between 1 and 3. If they're not coming for their routine checkups, I will see them at 2 or 3 and they're like, oh yeah, he's still on a bottle and he'll only take pouches. And I'm just like, oh my goodness, we have an issue here. We really need to intervene now. Otherwise, he's
Yep.
going to have massive issues later on in life. And so I think it's important for providers to educate their families that, yes, we need to talk about the food groups and variety and all of that. But we also need to talk about the skill that they have to learn and perfect in order to feed themselves properly. So I love that this goes into the skill aspect of it.
It is a huge myth that feeding just develops on its own, but we as parents need to realize that it is our duty as parents to provide that opportunity for learning, for chewing, for being able to develop those muscles to do it. I also think that so often as parents, we're just told like you need to have this many vegetables, these many fruits. And so I think that we do owe parents also the grace and the space for them to be able to learn how to do that education as well. Because I think we're all learning about food culture now. Like we all have our own thoughts and emotions and feelings about meal times in general. And so that's why it's so complex. And that's why we chose feeding and not an eating disorder for this, because it is that parent-child dyad.
And every family kind of comes with their own beliefs and their own, culture with how we choose to feed our children. And I've had multiple moms tell me, well, I have to force him to eat his veggies, but he eats them. And to me, that's an immediate red flag. Like if you have to force your child, I mean, I don't want to be forced to eat anything. And in my mind, I can imagine what that looks like. And I've seen plenty of videos on Instagram and YouTube of like literally a child like crying, screaming, and they're holding their mouth open, spoon feeding them foods that they don't want to have. That is extremely traumatic. And if we don't catch that as a provider, we're not doing that patient any benefit or helping them at all if we're not intervening, because there's a reason that the parent feels that they need to force feed a child, so we need to get to that point. And so it brings me to my next question about what interventions we can do, because sometimes you do feel a little bit helpless as a provider because this is such a complex issue that really it's impossible to quote solve within 10 minutes. And one quick tip doesn't make a child want to eat their veggies or sit down at the table without having a massive anxiety attack. So besides referring and making that referral to feeding therapy, what are some useful strategies that the pediatrician can offer to parents at that visit? Because the reality is sometimes they don't get into therapy for months.
Yeah.
And as clinicians, we do want to be helpful. So I would love your advice on what can we suggest to parents?
Other strategies that are just about the family dynamics, I think are really important to talk through with the family. The emotions that families are sharing with us are centered around shame and guilt and just the pressure that they feel. And I think if, as a provider, you're able to partner with them and help them understand that you're in this with them, that you see them, that you hear them, I think that by and large impacts the family's experience 10 times over. And so if we can do whatever we can to pull that pressure away a little bit and figure out what does a mealtime feel like and how are we showing up to the meal and how can we just start from scratch and take away the cloud that hangs over us at every single meal, I think that's something that can be worked on while anyone sits on a wait list.
I love that piece of advice because I find that building connection with your patient and with your family is the most crucial aspect of providing really excellent care. Because, we're all patients ourselves too, right? Like when you really feel that the clinician sitting across from you is actually listening and is actually like, okay, I'm in this with you. Like, let's brainstorm some ideas. You do feel empowered. You do feel like you have a support. You do feel like, okay, they're on my side. They're not also attacking me like social media is, like my family members are, right? So I think that is such a crucial point to just kind of take the step back. And I'll even tell parents and I'll say, this sounds like it's so frustrating and exhausting. And I can tell it's really challenging for you, but I want to tell you that you're doing a really good job.
Yeah.
And like that melts the moms when they hear that because you're right. They're hearing it constantly that their kid's too skinny and why is your child not eating this? And oh my gosh, he's so bad at the table. Like take him out of here. So I think that's a really, really helpful piece of advice that you reminded us to start with. Now, what other support is available for families within Feeding Matters or some other suggestions that you have that maybe the provider can suggest to their family?
I definitely suggest referring a family to Feeding Matters to get that emotional support because oftentimes, a family might be hearing really well-meaning advice, but it's advice that's not helpful. And so there is that peer-to-peer coaching and support that can be really valuable to listen to someone who's been there before or is in there with it with you. And so what we do in our Power of Two coaching program is we connect a new parent with a parent who has some of the training and knows about all the information that we offer to be able to be that listening ear and that sounding board where they need it to empower them to be the advocate that they need to be for their child and to, even just listen to venting sometimes. And so I would encourage if a family needs that support that you share Feeding Matters with them. We are a national, international nonprofit. And so we do serve everyone everywhere. And that's definitely one. I think individual communities have other supports that are in place. Oftentimes they're very provider specific, but we also offer like a family roadmap. So like if a family is wondering on the 6 questions, then you can take them down the roadmap too. And that's where I mentioned the family guide earlier, but that helps them kind of think about things, which is another thing to do while they're waiting is get more informed about PFD.
Wow, that's really, really cool. And is this fee-based? Do you accept insurance? Is it a free service?
It's a completely free service. So our rack card that I shared earlier is free. Any product that we have for families and providers is typically free and open source to be able to be used. The only things that we do have fees for are our educational offerings that really gets deep into the evidence-based practice and what is happening in each of the domains And how does that look and how does it manifest in any person's environment? And we really try to make sure we're bringing social determinants of health to the table with all of that. We also offer webinars that are available on our website. One of the most popular that is probably a great share if someone has experienced this and you are worried about the family is a feeding trauma workshop that really helps the family walk through like what kind of trauma might be happening, because I think, and it's because the field is still so new and so emerging. Like there are poor practices from the history. There's also not really great educational pathways for those that specialize in PFD. And so it can be really challenging to find the right provider and to find the right fit.
That is fascinating. This is such an amazing resource. So, where would clinicians find all of this and how would they learn more about everything?
Sure. So feedingmatters.org is our website. Our social channels are also at Feeding Matters. I will say that we are also starting to launch a campaign called It's Not Picky Eating. And that is the rallying cry. You mentioned it earlier. Like it's a really charged word when you're experiencing so much more than picky eating and you're feeling diminished because people just keep calling it that. And so that's a great resource for just the quick hit about like what is PFD and some of that as well.
I'm getting behind that for sure. I love that. Okay, I always end my episodes with my favorite question, and this is the worst piece of advice you've heard clinicians give to families with a selective eater or a child with a PFD.
Yes, it's the biggest one that sticks out of my head, which is that they'll grow out of it. I think there are many conditions in which we are kind of waiting and seeing and expecting things to change because our little kids' bodies look different every time you see them in the exam room. But oftentimes with feeding, any indication of it going down the wrong path, we got to be paying attention to it. And so I would caution anyone giving that advice without some scaffolding there, like another follow-up or something else.
Yeah, I can't stand when providers say that, although I understand why we do because often
It's
it
legitimate.
is
Yeah,
true. Yeah.
yeah, I get it.
And it's in our way, in our mind, what we're doing is we're trying to reassure the parent in front of you. But like you said, it's often not helpful. And again, we might be undermining something else more severe that's going on. So love that last piece of advice. Jaclyn, this has been such an awesome conversation. I have loved having you on here. Thank you so much for giving us such valuable and needed resources for our families to help us feed them better. And I just appreciate you for the gift of your time. Thank you so much for being here.
Thanks, Colleen, for having me. I really have enjoyed our conversation.